you see your mom's medical records? Let's talk about privacy legislation. If you haven't watched before, my name is Dr. Nicole Didick. I'm a medical doctor, a geriatrician, so that's an internist who has additional training in the care of older adults. Here on The Wrinkle, I try to give you information that you can use to age well or to help others age well. Today, I want to talk about privacy legislation. Now, my practice is in Canada, in the province of Ontario. Here in Ontario, we have a thing called PHIPA, which is the Personal Health Information Protection Act. It was enacted in 2004, but other provinces have similar types of legislation, and in the US, it's just called HIPAA, Health Insurance Portability and Accountability Act. But all of this legislation deals with your personal health information and how it can be collected, disclosed, stored, and even used for the purposes of research. I wanted to cover this topic because of an experience that I had recently. A very close family member of mine was admitted to hospital, and this family member was pretty sick. Being a physician in the community where this relative was admitted to hospital, I knew a lot of the doctors that were involved in his care, and I worked at the hospital where the person was admitted. So of course, my family was asking me why I couldn't just look at the hospital chart and find out who the doctors were who were looking after him, what was his admitting diagnosis, what medications was he on, and what were his lab results. It seemed pretty obvious to my other family members that I could just look at my family member's chart because I'm a doctor and because I'm a relative. But actually, because of PHIPA, I was not able to use my credentials to look at the relative's chart. What I could do was go into the hospital using all the appropriate COVID precautions, of course, and I could sit down with a member of the person's care team and look at the lab results. Or I could ask them about the lab results on the phone, and I could also ask them other information about my relative's health. Of course, all of this had to be done with the verbal consent of my relative. It was a pretty frustrating situation, so I understand privacy legislation and I work with it every day. But when it came to trying to look at my relative's information in a timely way, so that I could give information to other family members and get a better understanding of what was going on with their care, I wasn't able to do that. And it gave me a taste of some of the frustration that I think a lot of people feel when they're trying to help a relative or even just look at their own health records. So let's talk a little bit about PHIPA and other privacy legislation, the good, the bad, and the ugly. So PHIPA is the Personal Health Information Protection Act. Let's start with a few definitions. What is personal health information? So it could include things like your health insurance number or any other insurance that you have. Any details about your past medical history. What medications you're taking now or in the past. What doctors you've seen or where you've been admitted to hospital. It includes all of those things, but it could also include things like your family history. It could also include things like who's your substitute decision maker. Someone who has your personal health information knows a lot about you. But you have to give consent for any personal information to be collected or disclosed or used, even for the purposes of your health care. Consent can be implied or express. Express doesn't mean that you give the consent more quickly, but it means that it's written down or documented in a more formal way. Some types of personal health information collection or disclosure do need express consent, but some of them are just involving implied consent. So if you're admitted to hospital, for example, and the doctor who is looking after you wants to talk about your care with another doctor, maybe to get another opinion for the purposes of providing health care to you, they don't need to get express consent to do that. Implied consent will do. Usually that's the case as well when it comes to a lot of aspects of a care plan. So it might be considered implied consent that a nurse could give handover to another nurse, for example. So they're both involved in your care. They're in the circle of care. Who is in charge of your personal health information? Well, it's a HIC. A HIC is a health information custodian, and I didn't know that I was a HIC until I looked up the PHIPAA legislation. A health information custodian could be the medical professional, like a doctor, nurse, pharmacist, therapist, or it could be an institution, like a hospital or a family health team. The HIC is responsible for collecting your information and also for keeping it safe. The HIC has a responsibility to give you that information if you ask for it, and also to let you know what you need to do if you want access to your information. A big part of the PHIPAA talks about consent. So giving consent, withdrawing consent. It really kind of says a lot about how much control somebody can have about their personal health information. In order to give consent, the person has to be knowledgeable, so they have to understand what it is they're giving consent to. They have to be capable, so they have to be able to speak for themselves. They can't be suffering from a medical illness that would interfere with that. So that could be the case in some types of dementia, for example, especially in my geriatric practice. Or it could just be because the person is too sick to physically be able to give consent. You can withdraw consent at any time, and consent is not required if the personal health information has to be disclosed or used in the case of an emergency. Personal health information is precious and it's private. It isn't something that people should just be able to see without your consent or knowledge. But a few things are interesting about the privacy legislation in Ontario. For example, prescribed entities such as certain research bodies or government health agencies can use personal health information for the purposes of research. Now, most of the time that has to be done through certain very prescribed conditions. So, for example, if there's been a research proposal that's been submitted through a research ethics board. But in other situations, it could just be done for the purposes of healthcare planning. So it might be easier for some of those entities to see records than for you to see them yourself. So what are some of the things that are annoying about privacy legislation? Under PHIPAA, you do have to be able to get your records, but you can't always get them in a timely way. So you might have to wait until a provider is able to disclose them or discuss them with you, rather than being able to just look them up yourself. Someday, this might change through the use of patient portals. Patient portals would make it possible for people to look up their own lab results, sometimes in real time. There are some pitfalls when it comes to patient portals. They have to be secure, and a person would obviously have to usually have access to the internet, and they would have to remember their PIN number or password. For some of us, that's a big challenge, but not insurmountable. There is a danger that somebody could get some personal health information that they wouldn't understand. It might cause alarm, and it might not be possible for them to talk about it with a provider in a timely way, and there might be some unnecessary worry there. It might be that the information could be released to the portal after it's been reviewed by a doctor or nurse, depending on the case. Patient portals have been shown to improve the patient experience. People do tend to like them. And it can improve communication between patients and their providers. And that makes sense, because if you can access your information, you can discuss it with your doctor in a more prepared and sort of more co-management way. Rather than just being told everything about your health, you can get some knowledge yourself, maybe even do some research, hopefully from a credible source, like the Wrinkle, for example. And then you can talk about it with your doctor. Some provinces are way ahead when it comes to patient portals. That's not the case in Ontario, at least not in a universal way. Getting access to your personal health information or that of a close relative right now is a challenge. A lot of this is related to the privacy legislation, which is there for a reason. It's there to protect valuable and private information. But it can seem to make things difficult, and sometimes it gets in the way of trying to manage a person's healthcare issues along with their healthcare team. I hope that we can see patient portals become more available in a widespread way. I'd love to hear what you have to say about it. Please leave a comment down below and tell me what your experience has been with trying to get personal health information, either about yourself or a close relative. Maybe you've had a really good experience, and I would love to hear about that. Thanks for watching today. And if you enjoyed this video, please like it and subscribe to my channel here on YouTube. I also have a website, thewrinkle.ca, where you can see all my videos, as well as some articles that I've written, and you have an opportunity to comment there as well. I answer every comment that I get. You can even sign up for my newsletter so that you won't miss a single video. Thanks again for watching, and I'll see you next time.